I do. I'm just wondering, Dr. Gustafson, or even Minister Dix, whether there's an update on the COVID-19 app and the conversations, why are there still concerns around this as an additional tool, the federal app, and are contact tracers, are people being moved out of the healthcare system right now, those who give immunizations or vaccines, are they being moved out of those positions right now to help contact trace?
With respect to the contact tracing app, I do want to let you know that we reviewed that app very, very carefully, and we reviewed it with the people who do contact tracing and do a lot of contact tracing and do it very, very well. And based on the features of that app, mostly because of the type of information that's provided to individuals, it wasn't felt that at this point in British Columbia it would have additional benefit, would be additional value to the existing contact tracing. The other thing that I'd like to say about apps and digital tools is that we are learning every single day. And while we may not have been entirely clear on what digital tools would be helpful for us in BC, we are, as the epidemic evolves, as our skills and our workforce in responding to an epidemic of this size are evolving, we are actually identifying the digital tools that will be helpful for us and that are helpful for us, and those are being developed and rolled out as we speak.
Yeah.
And I'm going to hand it over
as you'll know, Richard, we're obviously have done a lot of work, and Dr. Henry, Dr. Gustafson, and others work very closely with federal officials in other provinces, and so we're going to continue to do that. I think our goal is to ensure that any additional app in British Columbia contributes to the situation and does not make it harder to do contact tracing. And so that's our goal, and we haven't stopped working with the federal government on these issues and other levels of government. We're going to continue to do that, and I think what Dr. Gustafson said is the important point. We're going to, on this question of the COVID app, follow the advice of the people who do this work, the people in public health who do contact tracing, not just during pandemics, but all the time. That is their job and their, in some ways, their specialty in life. We're going to follow their advice first and continue to do so on this question and on others like it. With respect to the hiring of contact tracers, as you know, between 500 and 600 people have been doing this work since the beginning of the pandemic. Many of them have other jobs, and so one of the reasons we're building up public health, why we announced 500 more people to do this work, why we've hired 523, why by the end of this week I believe it'll be more than 600, and why we're going to add 800 to 800 so that public health is able to do not just contact tracing but all the work that it does. And this is a key part of what we've been doing. It's why we started in advance of this fall period, which I think everyone understood was going to be difficult given respiratory illness season. And it's why we started doing that work in the summer. And so what we're doing is building up the overall strength of public health, and that means doing all of the work of public health. But this work has been particularly important in recent weeks when you have more than 6,000 people who are being monitored by public health. Adding hundreds of highly qualified people to support our efforts is a good idea, and I'm very proud of the work they're doing, and having had the opportunity to see some of them in action on Thursday, for example, I can tell you they are extraordinarily committed.
I hope to ask, what is it specifically about the app that BC finds concerning, and why would the app make contact tracing more difficult? Thank you.
Well, that's an excellent question. So the app that in its current state can inform an individual that they were exposed to COVID-19, but it isn't able to notify and tell them when, how long, what they need to do, how intense that contact was, how close that contact was, when it occurred, and what they need to do about it. So one of our challenges is that in order to act in a meaningful way on an exposure about information, you need to have some details about it, so you know whether or not that's an actual exposure, whether you need to seek, you need to self-isolate, whether there's a significant risk to you of COVID-19 above and beyond the background risk. And I think that's the other thing to keep in mind, is that we all know that COVID-19 is transmitted and circulating in our communities. So there are certain basic things that we all need to do all the time. We monitor our health. We isolate if we become sick. If we have any symptoms, we stay away from people who are vulnerable. We seek testing as necessary. We wash our hands. We wear masks. All of these things are basic things that we all need to do. So being told that you were near someone with COVID-19 doesn't change any of that. It's what you would be doing as a background activity all the time. What we're working toward in British Columbia and with our federal partners is to improve these tools to allow us to provide information to people that is in addition to that background regular behavior that we need to maintain during a pandemic, during a global pandemic. And that's what we're working toward, to make sure that the information that any digital tool is able to provide is providing people with information that would change their behavior based on that information.
Do you have a follow-up?
Yeah, I think, hope that, so last week Dr. Henry said there are some parameters built into this app that she doesn't feel work. And I wonder why she thinks the app doesn't work for everyone else except Alberta seems to think they work. Thanks.
Well, I think at the moment, I believe a lot of provinces have signed on and are evaluating the app and using the app in their communities. And this notion of does it work depends on what your goals are. And here in British Columbia, our public health teams are reaching people, are doing contact tracing, and are able to give the specific information that somebody who has been in contact with COVID-19 needs in order to make a meaningful change in their behavior that reduces the risk to the people they love and to their communities. So at the moment, based on what we see here in British Columbia, the additional information provided by the app wouldn't add to the existing ways and methods of contact tracing. Again, this is right now in BC. We're all continuing to develop tools, to develop methods and ways of reaching people who have COVID-19 or who may have been exposed to COVID-19, to give them the specific and meaningful information that allows them to make the changes in their behavior based on that information.